blood oxygen in patients with hypotonic hypoxia. Cyanosis is one of the symptoms can be observed along with the changes of the parameters. In hypotonic hypoxia, the partial pressure of oxygen in artery will drop because you don't get enough oxygen in your circulation system, and the saturation will drop, and the capacity of oxygen, is normal because that's related to the quantity and quality of hemoglobin, and there's nothing wrong with hemoglobin or blood or RBC of this type of patient. So this is normal. And the oxygen content has dropped, and the changes at each end of arterial and venous oxygen level can be dropped because you don't get enough oxygen to use, so the tissue can only use less, or it is still normal. The cyanosis is a clinical symptom naturally will be noticed by patient and clinical doctors. It's a bluish or purplish tinge to the skin and mucous membranes. Approximately over 5 grams of unoxygenated hemoglobin in the capillaries generates the dark blue color appreciated clinically as cyanosis. Here, the value of unoxygenated hemoglobin is 5. Then what should be the normal value of people without cyanosis? Or in other words, let's put it this way. There are a lot of unoxygenated hemoglobin in the capillaries make you show the dark blue color, which is called cyanosis. Then how many unoxygenated hemoglobin in your capillary is within the normal range, or is there any unoxygenated hemoglobin should be found in the capillary of patients, of normal people? You may say no, but the answer is yes, there are unoxygenated hemoglobin, but just not to this high level. What are the unoxygenated hemoglobin? They are the empty ferry boats. The function of those hemoglobins are take oxygen from the lungs and transport them to the tissue cells. When they come back, they are empty. They are unoxygenated. So we should have a certain amount of unoxygenated hemoglobin in our capillary, but not to this high level. It should be around 2.6 to 2.8, not up to 5. Okay, the second type, abnormality of hemoglobin, like I mentioned, the ones without abnormality of hemoglobin, the capacity of oxygen won't change. So think about the hemic hypoxia, which is the second type of hypoxia I'm going to mention. The capacity of oxygen obviously will change because hemoglobin is not normal. Hemic hypoxia refers to the altered affinity of hemoglobin for oxygen or decrease in amount of hemoglobin in the blood. So, which is the quantity or quality of hemoglobin affect the ability to make good use of oxygen. And the most popular reasons to cause hemic hypoxia, one is anemia. As we know, anemia patients, they look pale, they have less RBCs. Hemoglobin stays inside of our RBCs. If you have less RBCs, of course, naturally, the quantity of hemoglobin will be decreased. And the other type of hemic hypoxia, clinically, very popular clinically, is carbon monoxide poisoning. Carbon monoxide poisoning. We will have a break, and after that, we'll